How's it going, guys? Difficult question for 2CK. For studying for step 1, I'll tell you some highlight points you need to know. 35-year-old woman, headache, fever, vomiting, 24 hours, temperature 103 Fahrenheit. Examination shows weakness of the left upper extremity, nystagmus. Optic fundi cannot be visualized. Kernig-Brzezinski signs are positive. Question wants to know the next specific diagnosis. So clearly we have meningitis here. Kernig sign is where you have a supine patient attempt to bring the chin toward the chest. It's going to cause involuntary flexing/spasm of the hips and knees. Brzezinski sign is where you have a supine patient and you're going to attempt to extend the knees when the hips are flexed, and that'll cause pain and resistance in the hamstrings. So the point is, we've got meningitis here, and we're just looking at the next specific diagnosis. I said it's a difficult question. Choice A, blood culture is wrong fucking answer. It's not to say we couldn't do them in this patient, but it's not the first step we do for meningitis. Blood cultures before antibiotics is what we will do for suspected endocarditis, okay? So for endocarditis, where you have new onset murmur plus fever, blood cultures first, then you're going to do empiric gentamicin, vancomycin. Wrong fucking answer. Choice B, CT of the head, correct answer. Now, the reason it's difficult is because you need to know that for meningitis, you do CT before LP if there's vomiting, if there's seizure, if there's focal neurologic signs, which we have here with the left upper extremity, or if there's papilledema, which reflects increased intracranial pressure, or the optic fundi cannot be visualized. Okay? It's not dramatic, but it's something you have to know for 2CK, and it shows up on the NBME exams. Students choose LP, it's wrong. They're like, OMG, why is it wrong? Okay, well, I just fucking said you've got some criteria that could reflect an intracranial mass lesion that you have to rule out, because if the patient has an intracranial mass, such as a tumor, and you do an LP first, you could cause tonsillar herniation and kill the patient. Okay, so if there's a seizure, vomiting, focal neurologic signs, or confusion that interferes with neurologic exam, I didn't mention that. Okay, so like a decreased Glasgow Coma Scale, confusion that interferes with the neurologic exam, or the optic fundi can't be visualized, papilledema, you're going to do a CT before LP. Okay, this is how you get a high score on 2CK. So that's your rule. Also, I said for endocarditis, tangentially, you're going to do blood cultures before antibiotics. It's reversed for suspected meningitis. You're going to do antibiotics before lumbar puncture or CT, okay? EEG, electroencephalogram, never seen as a correct answer on USMLE, okay? You could know factoidy that for absence seizures, they can say 3 hertz spike in wave appearance. For herpes, you can get PLEDS, periodic lateralized epileptiform discharges over the temporal lobe. Garbage. Wrong fucking answer. Choice C, observation acutely. Wrong fucking answer. Just to listen here, be a flagrant asshole, because if you're not sure, I mean, some questions don't want further diagnostic studies, okay? Tangentially, of course, if you have a Bell palsy, you can do Lyme Borrelia titers in endemic areas. About half the time, the USMLE can have that as an answer, but half the time, no further diagnostic studies indicated, okay? You're not going to do electromyography or nerve conduction studies for Bell palsy, okay? That's a high yield point I can give you. But for meningitis, you're obviously going to do an LP, but if we have the criteria as I discussed, you're going to do CT before LP. Choice C, wrong fucking answer. You know the deal. I'm going to make more content. I feel like my stuff, subscribe my channel. Appreciate your time. That's it.